Hi class! Today we're going to be talking about diagnostic imaging. All of the content for this PowerPoint is going to be in chapter 31 in your text, and again we're talking about diagnostic imaging today. As always, we have your learning objectives here, so remember to review those so we make sure we're on track with what you need to learn for testing purposes. Okay, so to begin with, we're going to talk about radiology. Radiology is the branch of medicine concerned with radioactive substances, including radiographs, radioactive isotopes, and ionizing radiation. There's three specialties into which radiology can be classified: diagnostic radiology, radiation therapy, and nuclear medicine. Most often when we think about radiology, we think about x-rays, and so we often think about the type of diagnostic radiology, which is when we take a radiograph to diagnose a patient. Some people may be thinking of radiology or radiation therapy when they think of radiation, and that is when radiation is often used for cancer. So that's an example of that. And then nuclear medicine we're going to talk about a bit later in this PowerPoint. So radiology can be further classified as either imaging, interventional, or therapeutic. All of the specialties are valuable tools that can be used to diagnose and treat diseases. Radiation safety. So x-rays are extremely powerful, and they can be either beneficial or dangerous and harmful to both the personnel working with them, but also to our patients. Exposure to radiation can destroy tissue and permanently damage the eyes, bone marrow, and skin. So that's why it's important to make sure we're using radiation properly and safely. X-rays are harmful to the developing embryo and fetuses, causing severe anomalies and sometimes even death. So any woman in childbearing age needs to have a pregnancy test done before any type of radiological study is done on them. The benefit of x-rays is the ability to use the information to diagnose and manage a patient's disease. The diagnostic benefits outweigh the risk oftentimes, and so sometimes the provider will weigh that risk and benefits of the patient being exposed to that x-ray. And one of the most important tasks for us as medical assistants is to make sure that patients are adequately prepared for any type of radiological procedure that they may be going for. Some other safety information. So the personnel working in the x-ray department must wear a dosimeter. This is a small badge-like device worn to measure the amount of x-rays that the person is exposed to. The dosimeter is read on a regular basis, and radiation exposure is reported to a supervisor. So we want to make sure that our patients are safe, but also our personnel working with these x-rays are safe, so they actually wear those dosimeters to make sure that they're not putting themselves into too much risk by being exposed to those x-rays. So exposure can come from the x-ray beam itself or from scattered x-rays that are produced when going through the patient's body. So oftentimes you'll see the x-ray personnel behind a wall, and that is to prevent those x-ray beams from getting to them. They can also wear these vests or these aprons that you'll see this gentleman at the top is wearing to block those x-rays from getting to their vital organs as well. Patients must wear lead aprons over reproductive organs, and technicians must shield themselves with lead aprons and gloves when assisting. Shields are not necessary when standing behind the lead wall and working the control panel. So they don't have to wear those shields if they're going to be behind that lead wall and just shooting the pictures behind that wall. Okay, so how do we get these radiographs? How do we get those? So we use there's three main parts to an x-ray machine. First, there's the table. This is where the patient lies, and the table is actually movable. So we can move the table to reposition where the patient is. We have the x-ray tube, and this is where the x-rays are produced and exit as a beam of electromagnetic radiation. And then we have the control panel, and this is positioned behind a lead wall, and it's specially designed for shielding the radiographer from the x-rays. And then lastly, the radiographic film is placed beneath or behind the patient's body. So let's say a patient is going to get a chest x-ray. Chest x-rays are very common. The patient would lay on this table. We would then position the table to be directly underneath that x-ray tube, or where it allows that x-ray tube to be placed right above his chest on the top. And then we would put that radiographic film underneath his back, so that when those x-rays, that electromagnetic radiation leaves that x-ray tube, it's going through his chest on the top and all the way to his back, where it's then bouncing off that radiographic film. Okay, and that personnel is behind that control panel and is popping those pictures when it's necessary. Okay, so for radiological tests, we often use what is known as contrast media. Contrast media is often used to help obtain a radiographic image of an internal organ or structure that ordinarily would be difficult to see. So the contrast media causes the organs or the structures of the body to absorb more radiation. Commonly used contrast media may include barium sulfate, iodine compounds, air, and carbon dioxide. Although contrast media is widely used, there's often some risk to using it. The patient could be allergic to this type of contrast media you're using, and that's always something that you need to think about. Okay, so in this picture, if you'll see here at the bottom, on the left-hand side, we have a picture of the, it looks like the abdomen, and then on the right-hand side, we have the same picture, except this time they had used contrast media, and we see where these, on this organ, we can see those lighted up areas, and that's actually allowing us to visualize more of that organ structure so that we can see using that contrast media. Okay, so patient preparation. It's our job as the medical assistant to provide patient preparation information and explanations about what the patient can anticipate. So verbal explanations should be followed up with written instructions. Many patients are anxious and frightened and can easily forget verbal instructions. So we always need to follow up whatever we tell the patient with written instructions, because they may be stressed out and not be obtaining that information correctly. So proper preparation is essential for best radiographic results. Okay, so let's talk about some types of radiologic diagnostic procedures. So this first one we're going to talk about is an angiography. The purpose of this test is to visualize the inside of the blood vessel walls, and it helps to diagnose heart attacks, strokes, and aneurysms. So we're going to jump over to how this procedure is actually performed and the information with that. So the patient is going to put on a gown. We're going to remove any eyewear, jewelry, or dental devices. This patient's going to lay on their back on the x-ray table. We're going to monitor them, their blood pressure, their pulse, and their oxygen level. They're going to have an IV inserted, and they may be given IV sedation medicine. An area of arterial catheter is going to be inserted. Oftentimes they will do this kind of in that crease of your thigh, right above, right near your pelvic area. They will insert, and you have an artery right there. They'll insert a catheter there. The catheter is threaded into an appropriate site, and contrast media is then injected through that artery. So that femoral artery right there, right above your thigh, contrast media is injected. And then images are obtained over the area of concern. So the digital angiography data can be stored on the computer. So information we need to tell the patient before this type of procedure: they don't need to have anything to eat or drink 6 to 8 hours before the exam. If they're diabetic, the provider may ask for their orders related to the diabetic medications, and they may be adjusted. We're going to tell the provider if the patient may be pregnant. We're going to inform the patient that there might be a generalized feeling of warmness when the contrast is injected. Many types of contrast media make you feel warm when it's injected, so we're going to always inform the patient about that. And then afterwards, we're going to monitor that arterial puncture. So if it's in that femoral artery, we're going to watch that area to make sure there's no bleeding. And then do not allow the patient to lift heavy objects or participate in strenuous activities until they're cleared to do so. So going back to this left-hand side, we see this picture here. This is actually some vessels of the heart. And we can see kind of this bigger branch in that left-hand corner is going off into those three smaller branches. If you see the one on the top, that top branch, there's kind of an area where it looks like it should be big, but it's really small. And that actually is where there is a blockage in that vessel, and where the contrast media is not able to get through. So we know there is an issue there in that blood vessel within the heart. Okay, so another type of radiologic diagnostic test is a barium swallow, or often called an upper GI series. This is to study the esophagus, the stomach, the duodenum, and the small intestine for disease. So we're going to jump again over to how this is performed. So the patient's going to put on the gown, we're going to remove any extra devices, any eyewear, jewelry. Then the patient's going to be asked to drink about 1.5 cups of flavored barium mixture while standing in front of a fluoroscope. The radiologist observes the passage of this barium mixture down the digestive tract. The patient is turned in various positions to allow good visualization of the intestines. Radiographs are taken over time as the barium moves through the digestive system. So again, remember, we're watching it go down the esophagus, into the stomach, through the duodenum, and into the small intestines. And things we need to tell this type of patient is 2 to 3 days prior, they're going to start a low-fiber diet. The day before, they're going to have a light evening meal. After midnight, they're going to have nothing to eat or drink. They're going to have to remove all items that might be visible on an x-ray. Of course, we're going to tell the provider if the patient may be pregnant, inform of them if they have any allergies, because they may be allergic to that barium mixture. And then following the test, we're going to inform them to increase their fluid intake and take a laxative to make sure that this barium gets moved through their digestive tract and out correctly. Okay, so similarly to the barium swallow, we have a barium enema. This is a lower GI study, and it's to study the colon for disease. So how this is done is the patient is going to lay in a lateral position on the table. The colon is then filled with a barium sulfate mixture by the enema. The patient is then turned in various positions to allow the barium to fill the colon. Air is also injected to move the barium along the colon. So it's kind of pushing that barium up into the large intestine through the colon so that we can see all of the areas. And when the colon is completely full, those radiographs are taken. So preparation for this test, the prep kit would include a bottle of magnesium citrate and Dulcolax tablets. So the day prior, they're going to have clear liquids, no milk or no milk products. And they're going to drink 8 ounces of water every hour until bedtime. Late afternoon, they're going to drink that bottle of magnesium citrate. And then the early evening, they're going to also take those Dulcolax tablets as prescribed. They can have a liquid evening meal, nothing to eat or drink except water after dinner. And then the morning of the procedure, they're going to make sure they have nothing to eat or drink. And they may be provided a cleansing enema. Of course, again, we're going to inform the provider if the patient may be pregnant and inform of allergies. We're going to increase, following the procedure, then we're going to increase their fluid intake and their dietary fiber. And along with this, we're also going to report to the provider if there's no bowel movements within 24 hours following the procedure. Because sometimes this barium can cause constipation. So we need to make sure that their system is able to get that barium out. And if it's not, it needs to be brought to that provider's attention. So we have a cholecystography. This is the study of the gallbladder for disease and inflammation. For this, we are going to position the patient on the x-ray table on their back. They are going to have had either a high-fat beverage meal given to stimulate the gallbladder. They're also going to have contrast tablets given to them to allow stimulation of that gallbladder, and then the radiographs will be taken to check that gallbladder function. So some preparation for these patients would be fat-free dinner the evening before the test. Take those contrast tablets with 8 ounces of water prior to. They may have a cleansing enema, nothing to eat or drink after dinner. They're going to inform the provider if they may be pregnant and inform of any allergies. And we're going to inform the patient that they may have a warm feeling when they have that contrast. Okay, so we're going to now switch over to our second video and talk about mammography.